Hello and welcome dear learners on the NPTEL course on Healthcare Quality Management, Patient Safety and Infection Control. In the Module 1 in continuation, we will be discussing more on the Chapter 12, Concept of ISO 9000 and NABH in Healthcare in little detail. Now, after studying the JCI, we are moving towards ISO, the entire philosophy how ISO 9000 works as in healthcare. And even we will be studying about what is NABH. NABH, which is of a prime importance in Indian context, how we have to take up with. If we go with the ISO 9000 and overview, the ISO 9000 family of standard acts as general sets of guideline, both manufacturing companies as well as service providers also. You may find the entire lessons that we study are more from the manufacturing companies that we get more in the ISO context. In service providers also, as healthcare comes into the service provider industry, we can interpret and put it into practice and get the benefits of the ISO. It highlights the key ideas that organizations should follow. ISO is something like a culture that an organization has to develop for the quality part. However, the standards gives companies much room to develop a quality management system that is called as QMS. The organizations or hospitals who have developed with this philosophy of ISO 9000 need to develop a QMS that suits through the specific need as long as they meet the basic requirements. The core principles of ISO 9000. The main beliefs behind ISO 9000 are focusing on the customer, where you find it is first to be seen as the customer comes first. Strong leadership, the involvement of all employees, the process way of working that is focusing on the activities. Managing the entire company as a system or organization. A goal of never ending improvement, where you can say that if it is that we have completed and we have now reached, there is nothing such as called as ISO over there, where you have to improve and continue the improvement. Making decision based on facts and data. Building beneficial relationship with the suppliers. The process approach is particularly important. This method of ISO centers the company's attention on how its day-to-day work is done. You may find the process approach which goes more better connect the company's goal with the outcome it achieves. So there is a relationship that you have to identify over here. The standard is built around the fundamental idea of PDCA. We have studied about the PDCA. Now we will try to understand how PDCA, which is very familiar to be used in quality, that is plan, do, check and act. These are the 4 steps actually that we have to take the process approach part. It emphasizes the necessary steps a company should take to operate, which is equally applicable in healthcare also. It also strongly encourages the setting goals, reviewing performance and the need for organization to continuously go better. You can see the figure over here where you may find that the plan is over here where it finds the healthcare market, customers requirement and individual patient inquiry or accident. That is a plan. Where you come up with the next, that is PD, that is the D part where it is do, where your diagnosis, patient care, patient treatment, diagnosis treatment, patient treatment and care of individual being seen. Where your check part is more measuring and analyzing actually what needs to be improved over here. So it is more towards going for the best practice and patient satisfaction, which is very important. And if you do identify if there is any need actually which is required, then you work on the act part. That is the strategic information that you have gathered, working on the information and even putting to the top management in policy and objectives to work on that. So this information flow which is going with PDCA helps actually to identify, work on the problem and give the solution. If at all there is a more requirement, you can run one more cycle of PDCA over here. Now we can focus on in little micro level the input, process and the output. The input over here is more towards the patient referred, patient care process and patient discharge, where many times what happened, the patient is being referred, but in the care process part there is lot of problems or delays actually which affects actually the patient discharge. Now in diagnostics we find the test necessary, the laboratory test process and the result delivered actually. The third example of accident appointment, where you find the ambulances process or even taking the in charge actually and the patient delivered. So the input, process and output is one to be seen very clearly to be understood in this figure. Using ISO 9000 in medical care. Because of its structure and the main ideas, ISO 9000 is suitable for healthcare sector. What it is like and how it is benefiting. Just as it is being successfully used in the other industry, particularly manufacturing, it can also be seen very usefully be working in healthcare. It can be used by any organization within the healthcare field, no matter the size or the type is, whether it can be a 50 bedded, 100 bedded or even 500 bedded or even more than that. These hospitals can be seen to adopt the ISO 9000 in if it is to be institutionalized to develop a culture of quality. The institutions can be hospitals and even being clinics, as well as even the support services in the hospital, specifically like laundry, linen and other services. The healthcare flow, especially for medical service delivery, is mainly centered on needs of the patient. A healthcare provider goal is to ensure the patient has smooth experience from their initial contact to the departure, from the admission to the discharge. The admission has to be seen as a very regular activity actually to see how the patient has come, what is the follow-up, whether it is a patient who was actually admitted previously and how you need to work on his discharge, how you need to see actually how when the patient is being staying in your hospitals. It is satisfied with the care received, whether the patient and the patient's relatives are satisfied or not. Applying the concept to the healthcare, ISO 9000 pushes a company or a hospital to concentrate on the customer, that is the patient, and their satisfaction with service they receive. So the emphasis is more on the satisfaction part over here. In a medical setting, the primary customer is usually the patient. Yet, other stakeholders are also there. How you need to take of the other stakeholders? The other stakeholders are also considered as customer, such as companies paying for the employees' health plans, insurance provider, family members, and other medical facilities. So you need to see the entire gamut of the stakeholders to be widened over here. When we view the patient as the main customer, the plan, do, check, act model can be applied to their care processes. It is very important to emphasize that plan, do, check and act. These are all the steps where first you can see on working on the plan, next level on the do, the third level on check, and if it is not working, you have to act on it actually to improve it. If though there is any such as something which is pending over there, can even work on to repeat the cycle of the PDCA. What are the advantages of implementing a QMS, quality management system? Adopting the ISO 9000 framework as in philosophy, it provides benefits, several benefits for the healthcare organization. Higher efficiency and lower expenses. Very easy to understand that QMS can give you this. By focusing on the processes of ISO 9000, it can significantly improve how efficiently work is done. The standard guides organizations to find ways to reduce the cost internally and for the people they serve as. So where you can find the higher efficiency and the lower expenses working on. better quality and dependability. The focus on processes along with commitment to customer satisfaction and ongoing improvement creates many opportunities to enhance the reliability and overall quality of medical services. The ISO 9000 also allows different organizations within the healthcare sector to use standardized services. This reflects to give the better quality and dependability. Support for regulators and funding opportunities. It is important actually in India, particularly for the more government bodies and law writers now believe that quality is necessary for better healthcare and that to a higher quality. So, important groups like JCI, Health Canada, and the IOM Institute of Management have confirmed this. Achieving the registration can lead to increased financial support and regulatory backing, which gives more emphasis to work on support for regulations and funding opportunities. Then come easier adoption of other quality systems. ISO 9000 can serve as a foundation that simplifies the process for organizations seeking other forms of approval or accreditation. It has been often seen as a good start for achieving JCI. Next comes improved care delivery process. ISO 9000 requires organizations to focus on how their workflow. In healthcare or hospital, this can help providers better understand the complex relationship within the field, such as those between hospitals and private medical practitioners. The relationship can be built up and to be worked more on to give up the improved care delivery process. Next comes how to work on the competitive edge. Earning the registration allows an organization to stand apart from its competitor, which is very important in the current times where you have to prove that quality can give you a competitive edge. It demonstrates to the customer that organization is devoted to meeting their needs and improving the service quality. It can give a major emphasis that you can put it to your competitors that how you are different from them and gives a competitive edge for that part. Commitment to ongoing improvement. The ISO 9000 emphasizes the importance of routine review and constant enhancement. Enhancement is one which is working on more better. For healthcare or hospital, where these elements are critical, achieving registration can be extremely valuable and can give a major benefits. The story of India's NABH. Why NABH standards are needed and what is the need where NABH will really be focusing on. Improving the quality of healthcare services is a goal for countries everywhere. So in India, the quality of care in both government-run institutions and private hospitals is often questioned. It is where from the public to the providers and from the government entity, they always try to see that why this quality of care is being hampered. What is the reason that Indian institutions are really questioned always for quality? Why are Indian hospitals being always being seen as a breeding ground for infections? Lot of issues which the government is also facing when they are trying to emphasize that yes, these organizations need to answer for quality. The National Accreditation Board for Hospitals and Healthcare Provider, that is NABH, which is a very popular and famous now in the field of quality, which aims to improve the quality of the entire healthcare system in India. What does the NABH really works for? NABH works with all professional groups to make sure high quality care is given while lowering the dangers of modern medicine. It has a great philosophy to see that the modern medicine which is bestowing actually or giving the dangers actually are not to be seen increase but to reduce it and ensuring the quality of care. History of the problem. It is known that quality issues in healthcare were ignored for many years and it was sidelined that there is no need of quality to be seen in healthcare. Healthcare is very complex, healthcare is very unprecedented, healthcare cannot really come up actually into the quality domain. And India's current system does not strongly push hospitals to become more efficient or accountable, unlike other systems in the other countries. So Indian current system needs to see and emphasize that hospitals need to adopt this culture. The private sector is very important in India. As you find, major of the push of even the patient is more towards the private sector, giving 50% or of more of the care, but government leaders have not focused on it as much as the public sector. So now where you find that there is always a shift which is moving towards the private sector, India has to deal with all these issues that the hospitals are facing. This has been left private system disorganized and poorly controlled, where you find they are taking major advantages of all these things. What does it leads to? It leads to clear problems with quality of care. Quality of care compromised, quality of care sidelined, and the patients are left over to the high out-of-pocket expenditure. The groups are now being needed to check the effectiveness of all services, whether it is medical or non-medical, in all hospitals, entire hospitals. The NABH process aims to make big changes in how the services are given. Along with the services, how the technology is being used, how the knowledge and the resources are managed, and how communities are involved. So NABH, if you do try to understand, it has whole lot of things. So from services to technology to knowledge to resources and management and even communities. The interconnectedness gives the more good process of NABH to work on. Then there is a question of why is NABH to be needed. So for understanding the why the NABH is needed, you need to know what is NABH. NABH is a part of Quality Council of India, which is the apex body for quality. It was created with the support of Indian government, Health Ministry, the Ministry of Health and Family Welfare, and the Indian health industry. With this support, there was the foundation of creating this. It answers to concerns raised by the public, by the government, by the doctors about the better quality care. So NABH has to answer all these agencies. It sets rules for health industry. It makes the health industry grow and also work independently, even with support from everyone involved in this. NABH standards and checking process. The rules. NABH experts wrote a full set of rules for checking hospitals that want accreditation. They make ensure that what is the need of the hospital with respect to quality. The rules helps hospital assure and improve quality, assurance and improvement. But the focus on patient safety is much required. The emphasis on patient safety is very importantly cited. NABH require hospital to constantly watch important events, what it is going on in the hospital with respect to quality, and fix problem completely and create a culture of quality at all levels, from the primary care to the quaternary care given to the patient. The rules apply both government and private hospital and nursing homes and are updated often. Many private hospitals are much in pro actually to take NABH, where government organizations or hospitals in India are more towards NQAS. Even you may find few examples of government institutions also working towards getting NABH. The core purpose and problem. The main goal of NABH is to help planners put in place and check strong practices. Current policies are not good enough to ensure acceptable quality and prevent mistakes. Problems include poor treatment, use too much of high-tech gear, and wasting resources and serious malpractice. This is all what problems I am counting on. But these are the current practices going on. And you may find quality checks should make services better. Quality is to be more towards working better. Quality is more towards efficiency. Quality is more towards cost effectiveness. While quality also ensures reducing errors and improving safety. So you may see that quality checks are to be giving more, better and best outcome. NABH focuses on continuous improvement in how the hospitals are working and treating the patient. So continuous improvement is one to be emphasized over here, where I pointed out actually that how a hospital needs to work on and treating the patient better and better, and not just on getting only a certificate or meeting the minimum rules and to just shine up that the hospital is having NABH. The 10 focus area now you need to focus and see that how the NABH rule really focuses on the specification. The figure highlights actually the patient-centered standard and organization standards over here. Patient-centered standards and organization-centered standard. Patient-centered standards actually of getting care and checking patient. Patient care, medicine management, patient rights and education, hospital infection control, and towards the organization-centered standards you may find constant quality improvement, CQI. Management duties, that is ROM, building and safety management, FMS, staff management, which is much more a part of an HRM, and information management. So mostly everything is being covered in the expected standards, which are divided into 10 specific areas. There should also be always a checkup principles, and NABH has emphasized to get this. The main areas when NABH checks as a hospitals are more towards that the hospital based on a good organization rules. The organization rules are one that the hospital should really work on if they have to get it an NABH accreditation. So NABH standards are truly being used in daily work. It is not that the daily work is being kept aloof out of this NABH standards and the standards are only work when you have to get the certification. Management and staff all agree that patient safety and quality are the most important things. There is a planned program to constantly improve quality by watching patient services closely, where you need to emphasize on patient services, where patient services, how they have to be informed, how they have to be proven actually, how they have to be improved. The final goal is to make sure quality stays the number one priority as the healthcare system grows, where you find that you can take it as a project actually to work on improving the NABH standards at your hospital. So in summary to this particular chapter of chapter 12, where I have emphasized more on the ISO part and NABH, where ISO 9000 is a universal guide for setting up a QMS, that is quality management system, that applies to both manufacturing and service companies, where healthcare is also one which has been seen a promising results for the ISO. The standard is based on 8 core principles, including customer focus, leadership and process approach, where you can identify that how an organization need to work on developing actually these core principles into the organization process. It uses the PDCA, that is plan, do, check and act cycle, as its main idea to ensure constant review and improvement, which is always that you have to work on checking and improving, checking and improving. ISO 9000 is highly suitable for use in all areas of healthcare, regardless of an organization size. There is no such as an organization in terms of volume that it cannot work for ISO. You can say it's an epic actually to reach the healthcare organization to achieve ISO. In healthcare, the patient is the main customer. Though other groups like insurance and family member also are considered, but patient has to be identified as a very important key factor actually to change the entire image of the healthcare. Particularly when you have to see for hospital, it is one like a hospital which is more focused towards patient need, a hospital which is more pro towards the patient, or have a comprehensive plan for the patient actually are one and more appreciable hospitals. The key benefits of using QMS includes potential gain in terms of efficiency, cost reduction, improved service quality and standard regulatory support. So QMS importance is also gaining more because of the efficiency part, also cost reduction, where many times it is being stated that quality has to pay a lot. Improving the service quality and the standard regulatory support is one which is to be emphasized to give more support for the part. Where on the other hand, where you find NABH which was created in India and it's a birth, Indian quality standards can be given to be seen as a better future to even to the world, where it is being very much praised that NABH has a better or even the bester of the quality that can be improved to be seen. The quality improvement to both public and private sector. So, which you find that the private sector which are largely unregulated, not controlled and has very poor outcome also has more emphasis of taking NABH and improving their processes. So, NABH standards cover specific areas like medication management, infection control and staff management. You may find out of these three very important areas where medication management is altogether a clinical administration part, which is a very core area that you have to study, and we will also be emphasizing more on a separate chapter of medication management, which is very important to understand that NABH has separate chapters to give more specification and detail how your clinical players, particularly your doctors, nurses and the quality team can work on improving the medication management. Infection control, which is no doubt an improving area where the NABH has focused on reducing the increasing load of infection in hospital, particularly the HAIs, healthcare associated infections or hospital acquired infection, where it emphasizes on reducing the superbugs actually which are developing the hospitals and which makes a greater issue actually for the morbidity and even the mortality. Most of the hospitals who are really known actually to take up NABH standards have reduced the load of infection by infection prevention and control practices. And not but the least actually to be focused more on the human resources, how to improve actually the people work functioning for the HR part. Also NABH has some focus standards on. So all modern accreditation focuses on continuous improvement in hospital performance and patient safety using comprehensive standard instead of just meeting the basic minimum rules. So here it is that the NABH is also taking lessons from all the global standards which are evolving. Even also NABH is also evolving actually to give more comprehensive standards which are adjusted with the needs and the basic minimum rules that a hospital is following. So in this quality journey, we will be continuing much more in depth actually discussing in the forthcoming chapters about the different standards and even developing towards your understanding on patient safety also. Now, you can see the references which are being used for chapter 11 and 12, which can also be used for your projects on quality. Okay, so thank you very much.